Live from the Broadcast Center in Los Angeles, this is KCAL 9 News at 7 a.m.
Dr. Michael Manuel from Dignity Health is here, and he is here to raise awareness about cervical cancer and how to catch it early. That's next. January is Cervical Cancer Awareness Month. It's a chance to teach women how to protect themselves from HPV, which can lead to the cancer. Here to talk about that is Dr. Michael Manuel, and he's the medical director of the LA Center for Women's Health at Dignity Health's California Medical Center. Good morning, doctor. Thanks so much for joining us this morning.
Thank you for having me.
It is Cervical Cancer Awareness Month this month. What are the signs and symptoms women need to watch out for?
So cervical cancer is one of those diseases that can be picked up very early and treated and cured. The main symptoms are abnormal vaginal bleeding, especially bleeding after intercourse, and abnormal discharge.
And what is the best way to detect cervical cancer?
The best thing, cervical cancer is one of those cancer screening success stories. The Pap smear is by far one of the best screening tests that has ever been developed in the world, really, and it has drastically reduced the death rate from cervical cancer. The Pap smear is by far the most important thing, and regular screenings are key. And there's been a lot of controversy about that because the screening intervals have changed, but getting to your doctor for a Pap screening test is key.
What do you think? Yearly? Is that the best advice?
You know, that's a good place to start, but for many people with normal Pap smears, the interval can be extended to either 3 or 5 years, depending on a lot of the new technology we have with Pap smears and the specific tests for the HPV virus, which causes cervical cancer. So with those new tests, sometimes we can extend the interval, but that should be done with your doctor discussing that with you.
And who's more prone to cervical cancer? Is this in one's DNA?
No, actually, cervical cancer primarily is caused by a sexually transmitted virus, the HPV virus. And it is not transmitted genetically or in families. And pretty much, you know, the HPV virus is very prevalent. It's prevalent with people who are sexually active. So many of us have the virus, and it's just a matter of screening for it, because for most people it doesn't cause any problems.
And what are the treatment options if and when someone is diagnosed with cervical cancer?
Cervical cancer is curable. It's very important to get into screening, and it can be picked up early and prevented. That's the key. Treatments are include surgery, chemotherapy, and radiation, depending on where the stage of the disease is when it's picked up. But this is a very curable process, and more importantly, very preventable with screening ahead of time.
Now, I read an interesting statistic from the American Cancer Society website. About 4,000 women, it's estimated, could die from cervical cancer just this year alone. But that number is dramatically lower, I guess, from many, many years ago. Do you think that the treatment options and just Pap smear early diagnosis is what's leading these trends?
Absolutely. The screening test is key. That really has dropped the mortality from cervical cancer in this country and the world. Unfortunately, many people in the developing world still don't get the screens, so the death rates are much higher. A lot of new technology, new drugs, new treatments are coming out to hopefully help reduce that death rate from 4,000 to even lower.
Okay, well, this is the month to stay educated. Thank you so much, Dr. Michael Manuel from Dignity Health. Thank you so much for joining us this morning.